A second coronavirus vaccine now awaiting approval by U.S. regulators. Moderna announced its vaccine is ready, and if approved for emergency use, the company will start rolling out the first doses of the vaccine by late December.
We have worked very closely with Operation Warp Speed, and as we said, we should have up to 20 million doses by the end of the year. So as soon as we get approval, General Perna and his teams are going to get hold of a vaccine we have and start shipping it in the country. His goal is to vaccinate Americans within 24 hours from approval.
Moderna is a small pharmaceutical company based in Cambridge, Massachusetts, that has never successfully brought a vaccine to market. It got a big jump on its competitors because it started working aggressively on a COVID vaccine back in January, the very day China released the genetic data on the coronavirus. That early foresight is now paying off, the company saying it hopes to produce as many as 500 million COVID vaccine doses next year alone. Earlier this month, New York-based vaccine maker Pfizer and its German partner BioNTech announced its vaccine was also being submitted for approval and could roll out 50 million doses this year.
With Pfizer, we at the FDA announced an advisory committee for December the 10th, and if everything is on track, everything proves out what it appears to be, we could be looking at approval within days after that. Moderna is basically 1 week behind that.
Distribution of the vaccines could be a challenge that is fast approaching. The vaccines must be kept in cold temperatures at all times during transport and storage, or face the risk of spoiling and being ineffective. But it doesn't matter how many vaccines are available if people decide they don't want to take them. Here in the United States, one poll showed that nearly 40% of Americans said they have no plans to take the coronavirus vaccine. And within minority communities, particularly blacks and Latinos, the distrust runs even deeper, with the same poll showing that nearly half said, when it comes to the vaccine, no thanks. On Monday, New York Governor Andrew Cuomo said more outreach needs to be done to build trust with minorities to take the vaccine.
Blacks died at twice the rate that whites died. Brown died at 1.5 times the rate that whites died. They are less served by the healthcare facilities. We need a special outreach effort. Federal government has provided no funding to do that.
But global health officials say it's a problem around the world.
We have seen around the world a growing hesitancy about vaccine in general and about a COVID vaccine in particular. At the same time, distrust is growing for other public health interventions.
While there is growing anticipation of the vaccine rollouts, health officials caution it will likely be several more months before distribution is ramped up to meet global demand, to truly have a chance to end the pandemic once and for all. Gabriel Elizondo, Al Jazeera, New York.